So, for my topic, I choose to talk about parental influences on childhood mental health disorders. So, what is a mental health disorder? So, it is a condition that affects the way people think, feel, or behave. Just like how our bodies are able to get sick or injured, our brains can sometimes have problems too. So, these problems can make it hard for someone to feel happy, calm, or focused, and they might have trouble doing the everyday things like going to school or making friends or even communicating with an individual. So, who are involved? So, caregivers slash parents significantly influence a child's emotional well being through their parenting style, behavior, and emotional support. So, also, children are also impacted by their caregivers' actions, attitudes, and environment in which where they are raised. Um, there are mental health professionals. They assess, diagnosis, and treat childhood mental health disorders and provide guidance to parents who need the help to help their children and find a better understanding. Also, what? So, uh, parenting styles, disciplining methods, communication, and emotional expressions can significantly impact a child's mental health. Also, family dynamics leading to conflicts, divorce, trauma within the family can also contribute to childhood mental health disorders. And also, genetics can also run by the family. This can also diagnose, give a diagnosis to to a child, either early on stages or moving in their adolescent years. Where could this normally happen? So, home environment, the primary setting is where a child interacts with a parent and experiences like familiar influences, and also the school. So, academic stress can lead to intersect with a parent's influence. And when can these typically occur? So, um, parental interactions during early childhood can influence emotional regulation, so attachment patterns and coping strategies in young children. And also transitions, so major events like relocation, divorce, or a loss of a significant other, or a loss. So this can also impact a child's mental health a lot. Why? So kids would normally mock parental behavior, so affecting their mental health. Also, parent stress or trauma, or a parent dealing with mental illness can also pass from onto a child, increasing the risk of a mental health disorder. So for how? So there are parent interventions. So there are programs aimed to help parenting skills. So this will help promote a positive parent to child relationship. This also addresses dynamics and can reduce the risk of childhood mental health disorders. There is also therapy for parents, and it is a program to help parents and children get to the underlying issues and help contribute to the childhood mental health disorder. And for my bias, I do believe that parents are solely responsible for causing mental health disorders in their children. Bad parenting or family environments always leads to children developing mental health problems in a child. Um, if a child has mental health disorders, it's because their parents failed to provide a supportive and nurturing home environment. And